Hi there, everyone. Welcome to Frankly Speaking About Cancer. Why Can't I Stay Positive? My name is Kelly Kraft. I'm a program manager and social worker at Gilda's Club Quad Cities. And I'm going to share my screen here in just a moment so that you can all see my PowerPoint. All right, Kayla, can you give me a thumbs up if you can see everything just fine? Wonderful. All right. So today we're going to talk about why can't I stay positive? Everyone who is impacted by cancer in any way, shape, or form has had moments where they have a hard time staying positive, and we're just going to talk about that today. So a little bit about Gilda's Club and Cancer Support Community before we get started with our topic. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. And a little bit about Gilda's Club, Quad Cities. We are a cancer support community that provides free, 100% free psychosocial support to anyone impacted by cancer. So that's anyone including a person with an active diagnosis, survivors, friends and family, caregivers, and children and teens. And we do that by providing support groups, educational workshops like this one that we're in right now, healthy lifestyle activities, social events, and we also provide social work referrals. So if somebody calls in and maybe needs transportation resources, financial resources, we have a whole slew of resources that we can give people, and we also are connected with social workers and other professionals across the community to try to get people whatever it is that they need. So one moment, I'm just going to check to see the Facebook Live broadcast, make sure that's working okay here as we move forward. So just so you guys know, this program was developed by Cancer Support Community, which is our headquarters. And then I kind of added and changed some things for our purposes. So just so you guys get the idea of what we're going to go over today, I'm going to talk about, just setting stage, get some background information. We're going to talk about depression in cancer, grief in cancer, resilience in cancer, and then I'll give some cancer support resources as well. And if you see me looking over to the side over here, I've got another screen next to me monitoring the Facebook Live. So just forgive me if I interact with this computer over here a little bit. So we'll start with setting the stage. So these are some things that most people living with cancer end up dealing with at one point or another. Almost all of what I'm going to talk about today will resonate with both people with a diagnosis and someone who's caregiving for a person with a diagnosis. And I also think it applies to most people with really any chronic illness, and also just kind of anybody in life that's kind of going through a change. So here are the top 10 concerns across our Cancer Experience Registry 2020 report. So this comes from kind of a big survey that Cancer Support Community does of all of our members nationwide. And we get a lot of great data from it. We figured out that two of the biggest concerns of our people that we serve are eating and nutrition and cancer progressing or coming back. And then some other really big top ones are worrying about the future and what lies ahead, exercising and being physically active, and feeling too tired to do the things that we need or want to do. So these are some things that are causing some of the distress in our members and the things that can cause us to not be able to stay positive. So 49% of respondents were at risk for clinically significant levels of anxiety. So these are the patients and survivors. So that's almost half. And then 38% of respondents were at risk for clinically significant levels of depression. So that's over a third of our patients and survivors are at risk for clinically significant depression. And that's pretty similar to what we saw in caregivers in 2020 as well. So 49% of caregiver respondents had substantially worse anxiety than the national average. So that's, again, about half. 34% of respondents reported substantially worse fatigue than the national average. And 39% said that their health was somewhat worse or much worse than before they began their caregiver role. So these are some pretty big statistics that we're seeing and some reasons that people are having distress, some anxiety, depression, and having trouble staying positive. I'm just checking for comments on the Facebook Live here. All right, so living with uncertainty. 53% of respondents to the Cancer Experience Registry indicated that they're worried about the future and what lies ahead. So a couple of those things are having to put plans on hold, fear that a treatment will stop working, or fear that a treatment won't work. And so these are a few things that just deplete our resources and make it hard for us to feel okay, when these things are happening, we're not able to stay positive. This unmanaged distress, and we're going to talk about how to manage that throughout this time today too. Untreated depression. So we'll talk today about how to notice what's maybe a normal level of distress, a manageable level of distress and or sadness, and when it's to the point where maybe we need a little extra help. Unrecognized grief, we're going to talk a lot about today, and limited social support can deplete our resources. So distress is a mix of anxiety and depressive symptoms. It can do all kinds of things to us, like cause sleeplessness, lack of appetite, trouble concentrating, and just difficulty carrying out the things that we need to do day to day. And some distress is normal, especially when cancer is a part of our lives. But about a third of cancer patients experience significant distress, and only about 5% of those with cancer actually get psychological help. So we know that there are more people with significant distress that are not getting the help that they need. And emotional distress is often ignored, and this is pervasive throughout society, not just with people dealing with cancer. But we should be thinking of distress as another vital sign, not as something that you should just live with, something that, if our heart rate was out of whack, or our blood pressure was too high or too low, that's something that we would talk to a doctor about. We would try to get help with, not just ignore. We should think of the same thing with our mental health and our distress. So we want to say not to ignore it. Some predictable stress points. So sometimes when this distress level may be extra high to watch out for is right at diagnosis. So when somebody first gets that news and are dealing with this huge life change, that's a big stress point. Anytime when somebody's making a treatment decision, so they're facing a fork in the road and needing to make a decision there, that can cause some distress. If cancer progresses or moves to another part of the body, that can cause significant distress. And then also anxiety. So that's a word that we use a lot here at Gilda's Club, where maybe we are getting a scan or blood work or whatever it may be to see if our treatment is working or how well it's working. Or maybe we finished treatment a year ago and we're coming back for our checkup and getting a scan to make sure the cancer hasn't come back. There can be a lot of anxiety going up to that appointment, and not knowing, there's a lot of just unknown there. You're hoping that we're not seeing cancer get worse, but you can't know. So there's a lot of anxiety. And sometimes there is a period of time between a test and when we get the results from that test. And that amount of time can cause some extra distress. So this is a little activity I want everybody to kind of engage in. So if you're watching this, I'd like you to grab your phone or a piece of paper or something that you can take a couple notes on. And I want you to look at this list of statements. And I want you to go through them and in your head, just kind of decide how concerned you are about them. And any of them that you're moderately, seriously, or very seriously concerned about, I want you to just jot those down. It may be just one, it may be none of them. It may be a bunch of them, but I want to just give you maybe 30 seconds or so and just read through them and jot down the ones that you're moderately, seriously, or very seriously concerned about today. I'll give you just a moment. And if anyone's watching on Zoom or on Facebook Live right now, if you feel like commenting in any of these or just kind of how that made you feel free. But in general, just keep an eye on this list. This is the list of things that are causing you some distress right now. So these are things that maybe you might want to talk to somebody in your life about, depending on which list item it is. So if it's something like pain and or physical discomfort, that may be something you want to talk to your doctor about. If it's problems with your relationship or feeling nervous or afraid, that might be something to talk to your family or doctor as well. But family or somewhere like Gilda's Club or a therapist. But these are things that are giving you some distress that somebody could maybe help you out with. So we always want you to talk to your healthcare team about your concerns. So any of the things on this list, there's somebody on your healthcare team that can help you. So if it's a medical thing, that's a doctor. If it's a more emotional thing, a social worker. If it's a more procedural thing, maybe a nurse navigator. So I'm just going to read this out loud because I think it's one of the most important things that we'll go over today. So it's the burden of positive thinking. This whole why can't I stay positive? Sometimes the goal isn't to be able to stay positive. It's knowing that it's okay to not be positive. So I'll read this out loud. It's bad enough to have cancer, but when all of your family and friends are saying that you have to be positive and you have to fight this thing, and the patient is exhausted and beaten up by the treatments, it seems to me that adding that burden to be positive was just ridiculous. And I've got a couple of pieces of data here or some quotes from some studies that I think are really important. And just in general, for some people, staying positive helps them, makes them feel like they're helping themselves, and that is great. But for others, that pressure of thinking that you need to stay positive is a burden and can add extra distress. So this is from a study that was done with people with non-small cell lung carcinoma. And I'll just read this finding that they had in 2004. There was no evidence that a high level of optimism prior to treatment enhanced survival in patients with NSCLC, non-small cell lung carcinoma. Encouraging patients to be positive only may add to the burden of having cancer while providing little benefit, at least in patients with NSCLC. So for that type of cancer, and whether or not this is able to be used in other type of cancers, being like having that thought of being positive didn't help anything. And feeling that need to be positive when you're maybe not a super positive person just added extra burden. So here's another one from Tehran University of Medical Sciences Journal of Medical Ethics in 2019. I'm going to just quote it here. Extreme positive thinking may promote alternative forms of medicine that ultimately substitute effective treatment, and this is unethical. The emphasis on positive thinking for cancer patients may be too burdensome for them. Likewise, unrestricted positive thinking is not necessarily good for mental health. So there's nothing wrong with thinking positive if that helps you. But in general, if that's not something that helps you, there should be no burden to try and put on a happy face and think positive. And adding to this, here are some of what the burden of positive thinking can do. So again, if you're somebody who is feeling positive and that helps you, that's great. But some people just aren't. And it's okay to feel some sadness and anger at the fact that we're touched by cancer. And if you're feeling pressure to stay positive and to fight this thing, etc., these are some of the things that can happen. So having that burden of positive thinking can cause the inability to acknowledge that cancer is a difficult and frightening experience. We all know that cancer is difficult and it's frightening, and we should be allowed to say that out loud and to think that. And make it so that you feel this insistence to put on a happy face. If you want to put on a happy face, that's great, but you shouldn't be forced to feel like you have to put on a happy face. And also feeling guilty because you're unable to maintain a positive attitude. Sometimes we're not able to keep a positive attitude 100% of the time, and that's okay. And it can also hurt the belief that a wide range of emotions is acceptable. So it can make it so people think that all emotions aren't acceptable. When we have cancer, we can be happy, we can be positive, but we can also have hard days where we just had treatment, we're not feeling great, and we're mad at the whole thing, and that's understandable. So another little reflection exercise here. So everybody who's on Zoom or on Facebook Live or watching this afterwards, you can write this down, or you can put things in the comments, or you can just think about it. It's fine too. I just want you to maybe think about a time where you felt pressure to think happy, or put a smile on your face, or to find a silver lining in any of this. I want you to just think about maybe a moment when that happened. And so I'll give you a few seconds here. I'm just going to check the Facebook Live, make sure we're not getting any comments with that. All right. So let's move on to talking about depression and cancer. I'm just loading that Facebook Live here. So what is depression? We use the word so often in just our day-to-day lives when we're talking about being sad, when maybe we need to be talking about the difference between just feeling a little down and actual clinical depression. Because everyone feels depressed and down sometimes, especially when cancer is a part of our life. And it's totally normal when cancer is brought into our lives to feel new kinds of sadness, fatigue, and grief. But about a third of people dealing with cancer actually experience clinically significant symptoms of major depressive disorder. So we use the word depression all the time, but about a third of the people dealing with cancer actually show signs of major depressive disorder. So I want to talk about the symptoms of major depressive disorder and clinical depression as defined by the Diagnostic and Statistical Manual of Mental Illness, or the DSM. And that's the manual that we use to diagnose mental illness. I do want to preface all of this with, if any of this sounds like it may pertain to you or someone that you love, that's a time to talk to a doctor or a mental health professional, because only they can diagnose depression and help treat it. So depression is generally characterized by a depressed mood or loss of interest or pleasure. Symptoms must be persistent over the same 2-week period, and they must cause clinically significant distress or impairment in activities of daily life. So if it's not bothering you or impacting your life, then it's not clinically significant. So these are the actual DSM-5 criteria for depression. So to be diagnosed with major depressive disorder, which can be over a short amount of time. Some people do get diagnosed with major depressive disorder just maybe around a stressful time in their life, like a cancer diagnosis, and later they no longer meet the criteria for that, and they can, scale back on things. But it's good to know if you do have major depressive disorder so that you can get help with it. So the criteria are, of all these bullet points that I have up here, you have to have 5 or more of those symptoms being present during the same 2-week period. And it has to be different from your regular functioning. And at least one of the symptoms has to be one of those first 2 bullet points. So the first bullet point is depressed most of the day, nearly every day, as indicated by subjective report. So that's your own feeling or observation made by others. So if someone, if you're noticing someone appearing tearful all the time. So the second one that it has to either be that one or the other one is markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. So again, either you notice that or someone else notices it about you. So if you don't have one of those 2, it's not categorized as major depressive disorder. But in addition to one or both of those, you have to have 4 more. So the other ones that you can, you just have to have 5 or more, including one of the first 2, is weight change, up or down, of more than 5% of your body weight, or a big decrease or increase in appetite nearly every day. So insomnia or hypersomnia, so sleeping not enough or sleeping too much. A change in your motor movement, so either being more agitated or slower, more lethargic, fatigue or loss of energy nearly every day, feelings of worthlessness or inappropriate or excessive guilt nearly every day. And another one is diminished ability to think or concentrate or indecisiveness nearly every day. And then the last one is recurrent thoughts of death, not just fear of dying or thoughts about the idea of death, but thoughts of death, and then recurring suicidal ideation without a specific plan, suicide attempt, or specific plan for committing suicide. So there are a lot of options here, and you can see how this could look very different person to person, which 5 or more of these may be present for them in the 2 weeks. But you do have to have one of the first 2 or both of the first 2, and then all together 5 or more of them. And again, only a licensed mental health or medical professional on your team can diagnose depression. So if you feel like this matches you or someone you love, it might be time to talk to somebody on your medical team. So what does depression feel like? We're just going to go through some kind of symptoms of what depression can feel like. So some mood-related symptoms. These ones are the ones we already usually categorize as depression, things that we think of. So that feeling sad and hopeless, irritable, numb, feeling worthless, feeling down. So those are all things that might affect someone's mood if they were experiencing depression. But there are actual physical symptoms that can happen. Not all of these will happen for everyone with depression, but fatigue, that extra tiredness, appetite loss, or sometimes appetite gain, insomnia, not being able to sleep, hypersomnia, feeling sleepy all the time, and sexual problems can happen with people who are experiencing depression. So here are some behavior symptoms. Loss of interest in activities that you used to enjoy. That's a really big one. When we see that, that's a really big indicator of depression. Frequent crying, withdrawal from friends or family, and loss of motivation to do daily activities. And some cognitive symptoms. memory problems, trouble focusing, difficulty making decisions, and negative thoughts. So again, these are just things that may happen. I know some of these happen to everyone here and there, but it's whether or not it's that clinically significant, that DSM criteria, whether or not it would actually be categorized as major depression. But even if something just feels significant to you, even if it wouldn't be categorized as major depressive disorder, that's time to maybe get a little extra help or just talk to somebody. So we know that depression in cancer patients and cancer caregivers is really common. So approximately a third of cancer patients report a mood disorder at some point after their diagnosis, mostly within the first year after diagnosis when they have the greatest risk of having a mood disorder. And then 10 to 20% of cancer patients continue to report depression or anxiety after that initial stress of the diagnosis or recurrence. And then more than half of cancer patients and survivors report fatigue as an ongoing issue or struggle with pain and isolation. And on here, depression affects patients with cancer at 2 to 3 times more than the general population. So we know that it's really common. And we want to make sure to take that stigma away so that people can get the help that they need if they're, dealing with any of these things. And depression does affect men and women equally with cancer. So 38% of respondents to that cancer experience registry reported substantially worse anxiety than the national average. And then 26% of respondents reported substantially worse depression. And we know what that does. It impacts quality of life. And if you're dealing with unmanaged distress or unmanaged depression, it can impact our adherence to cancer treatments. It's hard to take your medication every day if we're unable to get out of bed because we're feeling depressed. Or we saw on previous slides that depression can impact our memory and our cognitive, can impair our cognitive functioning. And maybe we don't remember whether or not we took a medication or when our next appointments are. And it can also lead to longer hospital stays. So these are the reasons that if you are feeling any of these symptoms of depression, reach out to somebody because we want to make sure that you can get the help that you need. Again, tell your healthcare team about concerns. That's why we're here. That's why the doctors are there. They want to know what's going on. So what we also know is it's really treatable. There are all kinds of treatment for depression. There's behavior therapy, there's cognitive therapy, interpersonal therapy, problem-solving therapy, all kinds of different types of therapy. And then there are things that we can kind of do on our own too, with some help maybe from somebody to give you a little push of like what maybe to do is some exercise and mindfulness interventions. And there are also medications for depressive disorders. Usually, if you're having medication, the combination of therapy and meds is the most effective. And for somebody dealing with cancer specifically, if you have an active diagnosis, a medication may not be available due to other medication interactions, cancer treatments. So it's kind of a different situation. You have to talk to a doctor, obviously. It's also really normal to seek treatment, maybe including medication, for mental health during cancer or caregiving and other periods of distress. And you should always just talk to your healthcare team about how you're feeling. Just because you might need some extra help, again, maybe including medication during your cancer treatment or while you're caregiving, it doesn't necessarily mean you'll need it your whole life. You may just need it for a while. And then once that extra stress gets taken off of you, we can, reconsider what needs are still there. So if you're thinking about possibly needing a medication for depression, a doctor is going to talk to you about all kinds of different things to make sure they get the right one for you. So they're going to talk about your needs, what's been going on, what things are bothering you, how often, potential side effects for medication, just like cancer meds. Every medication comes with possible side effects, so you have to always know about those things. They're going to talk to you about other medications you take because some medications can interact badly with other medications. They need to make sure that all your medications are safe together and your medical history. So there are different types of depression medications, they all kind of just work differently. So SSRIs, SNRIs, just lots of different types work differently in different ways. And antidepressant medications typically take a while to start working. Some people start seeing some results after 2 weeks, but they can take 3 to 6 weeks. So if you start an antidepressant and you're not feeling immediately better, it's okay. It may take a while to get there. And sometimes a doctor will start an antidepressant at low doses to see if that's enough to help you before upping a dose to get it to the right spot for you. They don't want to give you more than you need. And that can help avoid side effects. But you still, sometimes they do have to add on, extra milligrams to get you to that good therapeutic effect. And one thing that I added to the slide is if ever you're taking a mental health medication, to make sure you always talk to a doctor before stopping or cutting down your own medications. Some of these medications your body gets really used to, and if you go cold turkey on them, it could really cause some problems. And also sometimes when we're on like an antidepressant, we think that maybe, oh, we're feeling better and we don't need this medication, when really it's the medication that's helping us feel good, and we do need to continue that medication. So always talk to a doctor. It may be time to go off of a medication, and the doctor would be able to help you safely do that. So let's talk about grief and cancer. I just love this little quote here. I'll let you read it. And I'm going to redo this Facebook Live, make sure we don't have any comments. So we think of grief as what we feel after someone dies, but grief is way more than that. We can feel grief when our lives change and when things just kind of don't go how we hope they will. So I'm going to go through some different types of grief here. So the first one is that I'm going to go over is living loss, and just kind of represents how we can experience chronic or ongoing sorrow. It's kind of the space between what is and what should have been. And really just a more ongoing, long grief. Another form of grief is ambiguous loss. So it's more of a sense of loss that is a little unclear and defies resolution. So something that we maybe don't know how to put our finger on. So we know that we've lost something, but we can't really maybe give words to it or say exactly what it is that we lost. And that makes it even more complicated to process. And the reason that I'm going through these different versions of grief is because we're so used to the grief model, the stages after somebody dies, but we don't think of this other type of grief that can also be making our lives a little more complicated and making it harder to kind of get through the day. And if we acknowledge grief, we can work to live with it. So another one is loss of the assumptive world. So all of us develop a sense of the world and a belief that helps us feel in control, gives us a sense of security. For example, we may believe that if we're good people, we work hard, then we'll have a good life. And some things can put this out of whack, like cancer. We may have worked hard and been good people, and then cancer happens. And so now we're not feeling like we're having that good life, that assumptive world. And so it kind of can make us feel stuck trying to make sense of why this is happening and why we lost our assumptive world. Another type of grief is termed disenfranchised grief. So this is when like our grief is invalidated, minimized, just not really acknowledged by the people around us. So an example is people might say someone should just be happy to be alive rather than expressing understanding that maybe their cancer treatment pushed them into menopause and prevented them from having children or having more children. And so that's a type of grief that somebody may not understand or may minimize. Another one is if you're caregiving, people think that you should just feel lucky that you don't have cancer yourself when you are having some grief with being a caregiver. and that should be validated, but sometimes it's not publicly acknowledged. And sometimes that invalidation can even get internalized within us. And so if we bring that back out and acknowledge the grief and the loss, sometimes we can work with it. And this one is kind of self-explanatory, the complicated grief, where we're used to, again, those 5 stages of grief. And sometimes it doesn't work that way. Sometimes it lasts a lot longer. And even though there's been time, a lot of time passed since we lost whatever it is that we lost, sometimes it doesn't feel better. And we're still, in those stages of grief that we feel like we should be past, and it's more complicated, and that's understandable. And another type is anticipatory grief. So maybe if you're caregiving for someone with cancer and you know that maybe the end of their life is coming, you may already be dealing with a type of grief. It's that anticipatory grief, or as somebody's cancer may get more and more severe, maybe they're not acting the same way that they always acted. And so you may feel like you've lost them, and you're dealing with that grief ahead of time. So that's anticipatory grief. And so what we want to work on is activating hope when it comes to grief. So when you're dealing with any type of grief, give yourself some self-compassion. Grief is hard, and it's not a linear thing that we deal with. It's a roller coaster. Help yourself find some meaning in life and acknowledge your grief instead of avoid it. One of the best things you can do is reduce isolation, be with others, and cultivate resilience, which we'll talk about. And I want everybody to remember that hope is not just like wishful thinking. Hope is adjusted and adapted over time. So another reflection, I'll give you guys a few seconds or a couple minutes here. I want you just to, again, you can write it down, you can just think about it, put things in the comments if you feel like, no pressure, but just reflect on what you're grieving. What are you grieving? And how can you honor and acknowledge your grief? So I'll just give you a minute here. And I'll keep going here. All right, so let's talk about resiliency. So one thing I just really want to point out, I'm not going to read this whole thing, but I want to point out that resilience is a process that happens over time. Resilience isn't something we have or don't have. It's something we can learn, and it's a process. There are a lot of different ways to define resilience, but most agree that resilience is a process that begins after a significant life difficulty, and it involves ongoing recalibration. So the people that kind of made that model of resilience propose a model of resilience that recognizes the ways in which individuals experience the world before cancer affects their response and ability to cope with cancer. So in their model, mindfulness is the foundation of resilience because mindfulness allows individuals to remain present with whatever challenges life presents. So we're going to talk a lot about mindfulness. So resiliency is an active process of facing adversity related to a cancer experience. It's the ability to restore emotional and physical functioning when confronted with stressful life events. It is not something that people either have or do not have. And it involves behaviors, thoughts, and actions that can be learned and developed in anyone. So mindfulness is a skill that can be learned. And I think this is really important, what mindfulness kind of is. It's paying attention on purpose in the present moment without judgment. And mindfulness, practicing mindfulness can be helpful for all sorts of things. It can help us with anxiety. It can help with depression, stress, fear, fatigue, pain, difficulty sleeping, and immune functioning. All right, so we're going to do a little mindfulness activity together. So if anyone's watching this, if you're comfortable with it, I want you to sink into your chair and try this with me. If you're comfortable with it, close your eyes and just let yourself be in the moment for this little mindfulness activity. So just close your eyes and focus on your breath for a moment. This is just an example of a mindfulness activity that you can do. So together we're going to do a body scan. This is a really simple mindfulness practice. What we're going to do is I'll say the name of a body part. You'll bring your focus to that body part and you'll relax it if you feel any tenseness in that part of your body. We're going to go nice and slow, focusing on little tiny parts of our body and trying to relax and let go of any tenseness that we have in those body parts. And I want you to remember, mindfulness is a practice. So especially if this is maybe one of the first mindfulness things that you've done, you're just getting started. It's something that we have to work on all the time. And you'll almost certainly have thoughts that come and go throughout this little practice. And I want you to notice when you have an outside thought enter your mind. You will. And acknowledge that thought without judgment. And then nicely bring your mind back to the body scan. Just back to that mindfulness practice. We're all going to have those thoughts that come in and out as we're doing this. But just notice that and then bring yourself back to the practice. So first, I want you to focus on your toes and relax them. We're just scanning all through our body and making sure there's no tenseness left. And our feet, relax them. And our ankles. And our lower legs. And our knees. And our upper legs. Letting go of any tension in our hips. Relaxing your abdomen, your stomach. Relaxing our lower back. And our middle back. Relaxing our chest. Relaxing our upper back. Our shoulders. Carry a lot of tension in our shoulders. And our upper arms. And our elbows. Our lower arms. And our wrists. Relax your hands and your fingers. Relax your neck. Relax your jaw and hold a lot of tension there. And our mouth and nose. Relax our eyes and our eyebrows. Relaxing our forehead. The rest of our head. Whenever you're ready, you can open your eyes. And I just want you to think about how that made your body and your mind feel. I'll just check the Facebook Live really quick. And that was just one example of a really simple mindfulness activity. You can find mindfulness activities all over the internet for free. There are books, magazines. If you do a Google search, you'll find a lot of great ones. So here are 3 daily actions that you can take. So looking for the good. And I'm not, when I say looking for the good, I'm not meaning positive thinking. I'm allowing for both thinking and feeling. It's more just about gratitude. One thing you can do to look for the good is write down 2 to 3 good things at night before bedtime. That can help with resilience. And then 10 mindful minutes. So like that body scan that we just did. There are a lot of mindfulness activities that can be done in just 10 minutes. There are a lot of apps out there that have 10-minute meditations, 10-minute guided imageries. There are great progressive muscle relaxation things that you can do. Just 10 minutes can help a lot with resiliency. And then acts of kindness. If you could do an act of kindness every day, that really helps promote resiliency. So that can be a big thing like volunteering, or it can be a little thing like calling up a friend and seeing how they're doing. So our key takeaways today are distress and depression are treatable. Resilience can be learned and strengthened. Positive thinking is not the goal. Acknowledging your grief matters, and you don't have to do this alone. So I'm going to go through a couple of cancer support community resources. I went through what Gilda's Club does at the beginning. Here is our cancer support helpline. It's 888-793-9355. And that's staffed by licensed mental health professionals available to give assistance. And they're open a little bit different hours than us. So it's really great if we're not available. Then we also have mylifeline.org, which is a great option for if you're going through cancer or caregiving for someone with cancer. It's really a great way to kind of get your whole treatment group and your whole team together on one page. The Cancer Experience Registry, we actually talked about quite a bit on this. That's where we got all of that great data about what distressed people are experiencing with cancer. So if you're interested in filling that out, it's a little kind of survey that gives people a voice, and that data is used to help with policy change. It helps let doctors know what's going on. It helps with things like this program, and lets the world know what people who are impacted by cancer are dealing with and what they care about. And then we've also got Open Options. This is a program that I love. It's one of our least utilized programs. It's a cancer treatment decision-making counseling program. It's one-on-one. You meet with one of our licensed mental health professionals. And if you're going through, if you're in a situation where you need to make a decision about treatment, so maybe your doctor gave you some options, one of which is maybe like a lumpectomy with chemo and radiation, and one is a mastectomy with XYZ, and you have to decide between those. And there are good things about both and hard things about both. You can sit down with us. We can go through your whole situation, your goals, your options, your network, and you leave that about 45-minute appointment with a list of questions to take to your doctor. And the idea is if you get the answers to all of these questions, you have all the tools that you need to make that treatment decision. It doesn't make the decision for you, but it gives you all the tools that you will need to make that decision. And then frankly, speaking about cancer, you're experiencing that, those are educational workshops. And so now I'm just going to check the Facebook Live for any questions really quick. And my contact information is up on the screen. You can go to our website. You can email me or call me at kcraft@gildasclubqc.org. Our phone number is 563-326-7504. I'm just loading that Facebook Live one more time. It looks like we're good. So I'm ending my slideshow and just wanting to thank everyone on Facebook for joining us. And I'll end this Facebook Live. Thanks so much.